School of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about the proper assessment of thorax and lungs. But first, let us talk about what is thorax and lungs assessment. Thorough evaluation of the thorax and lungs is an essential component of a complete physical examination. The traditional systematic approach involves inspection, followed by palpation, percussion, and auscultation of both the anterior, lateral, and posterior thorax. The experienced clinician may vary the order or use advanced techniques to further characterize the abnormal findings. The posterior thorax is best examined with the patient sitting upright, arms folded across the chest, and hands placed on the opposite shoulders. And now, let us talk about the purpose of thorax and lungs assessment. Respiratory assessment helps determine the adequacy of respiration and enables the identification of changes to respiratory function. It contributes to the diagnosis and management of a variety of pathological conditions and helps the practitioner to evaluate therapeutic interventions. In the beginning of the procedure, I have to check the orders first. And then, you must need to perform a hand hygiene. At this point, I must gather the necessary equipments for assessing the thorax and lungs. Good day, sir. This is Ria, your nurse for today, and I am here to perform an assessment. But first, is this patient Joshua?
Yes.
Which I will examine the thorax and lungs.
And yes, don't forget to close the door as well as the curtain for patient's privacy.
And now, let me explain the purpose of thorax and lungs examination. This is a very important part of the exam since many abnormalities can be detected by merely palpating, percussing, inspecting, and also auscultating the thorax and lungs as the patient is breathing. So for now, I will be going to conduct an examination or an assessment to your thorax and lungs. So do you have any questions?
None so far.
Okay, and then if you have, please don't hesitate to ask me.
Okay.
Sir, allow me to assist you in undressing. And at this time, allow me to put this drape on you. And then next, I will need to expose my patient posterior thorax. If you are checking your patient posterior part or the one that is exposed area, you can use a blanket to cover it to avoid exposing it and other than the one being assessed. Upon checking, I can see pink undertones, which indicate normal oxygenation, and the color of the thorax is consistent with the rest of the body. And for the structure, the height of the scapula is even, and the vertebrae is in midline. And for symmetry, the structure of the chest and the chest movement are all symmetric. And lastly, for respiration, it is smooth and even. And for now, I will be assessing my patient's anteroposterior and lateral diameters of his thorax. Upon checking, I can see pink undertones, which indicates normal oxygenation. And for the structure, the clavicle is at the same height, the sternum is in midline, and the costal angle is less than 90 degrees. For symmetry, the structure of chest and the chest movement are all symmetric. And lastly, for chest configuration, the diameter is approximately twice of that anteroposterior diameter, and it is normal. At this point, using the palmar surface of my hand, I will be going to palpate over my patient's spine and posterior thorax for me to assess the muscle mass, growths, nodules, masses, and tenderness. Can you please take a deep breath, sir? Take a deep breath. Again, sir. Again, sir. Again, sir. Again. 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 Again, sir. Upon checking, the muscle mass of my patient is firm and the underlying tissue is smooth, and the chest is free of lesion or masses, and the area is non-tender to palpation. And for tactile fremitus, it is strongest over the trachea and diminishes over the bronchi, and also it becomes non-existent over the alveoli of the lungs. And actually, there is an equal and moderate vibration noticed during speech, and it is normal. So for now, I will be going to assess my patient's thoracic expansion, wherein I will be going to place my both thumbs on either side of my patient's spine, which is at the level of T9 or T10. Take a deep breath, sir. Upon checking, my hands leave symmetrically outward when my patient takes deep breath, and my two thumbs separate 3 to 5 cm during deep inspiration, and that is basically normal. And now, I will be going to percuss my patient over the posterior and lateral lung field for tones using zigzag pattern, starting over the scapula and to the bases of the lungs. Upon checking, my patient's resonance is equal to the lungs, and dullness can be heard over the diaphragm, and the other parts of the thorax are all symmetric. For now, I will be going to auscultate my patient lungs across and down the posterior thorax to the bases of the lungs as my patients breathe slowly and deeply through the mouth. cup for me, please? Upon checking, the bronchovesicular sound is heard over my patient's scapula, which is moderate in pitch and amplitude, equal to the inspiratory pace to the expiratory pace, and the vesicular sound is also present at the periphery area down to the bases and laterally. And they're low in pitch and soft with longer inspiratory phase, and it has no signs of cracklings and wheezes as hiccoughs. So for now, I will be going to examine my patient's anterior thorax. And in here, I'm going to inspect the skin, bones, muscle, as well as the symmetry of lung expansion and accessory muscle use. So in here, I'm going to expose my patient anterior thorax. Upon checking, the coastal angle expands as he inhales, and as I watch my thumbs, they move simultaneously and symmetrically. And now, I will be going to palpate the anterior thorax of my patient and also the tactile fremitus.
99, 99, 99, 99, 99, 99, 99, 99.
Upon checking, the vibration feels equal but stronger in the upper chest than the lower chest, and it is basically normal. Next, I will be going to percuss my patient over the anterior thorax using the proper sequence. Upon checking, the resonance is flat over the areas of heavy muscles and bones, dullness over the areas of liver and heart, and tympanic over the underlying stomach. Next, I will be going to auscultate my patient's lungs through the anterior thorax as my patient breathes slowly and deeply through the mouth. Upon checking, tracheal sound is heard over the trachea. There are loud, there are high-pitched, and there are tubular. And bronchovesicular sound is also heard laterally and over the bronchi at the angle of Louis. And also, the vesicular sound is over the anterior thorax and periphery. At this point, I will be going to inspect my patient's breast and axilla. In here, my patient hands resting on both sides of the body, which is placing on the hips. Upon checking, the breasts are well defined, non-tender, no suspicious masses, skin or nipple change, while the axilla has an oval and lobulated in shape. Next, I will be going to palpate my patient's axilla with his arms resting raised above the head and against the side of the body. And in here, I will going to assist my patient in a supine position and placing a pillow under my patient's back. So in here, I'm going to palpate my patient's breast with a circular motion. Also, to check his nipples and my patient's axilla as well. And to the other side of the body. Upon checking, axillary lymph node has an oval or lobulated in shape and has a smooth and well-defined margin. Breasts are composed of homogeneously radiolucent fat tissue and muscle, and both has no tenderness, masses, nodules, or nipple discharge.
And then, assist your patient in putting back his clothes. And then, remove the drape or blanket. And yes, don't forget to remove your gloves. And yes, after doing the procedure, don't forget to perform a hand hygiene. And then, initiate appropriate referral to other healthcare practitioners for further evaluation as indicated.
And that ends my written demonstration about the proper assessment of thorax and lungs. I hope you learned something new from me today. I hope to see you next time in my another written demonstration. Once again, this is Aliyah Piayaras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching. Bye!